Thanks for joining us for KSAT's News at 9. I'm Steve Spriester. Coming up tonight, with more people out of work and in need of help, the San Antonio Food Bank's resources are being stretched thin. A local man and woman that were stuck in Peru are now back home and under mandatory self-quarantine. And just as we do every Friday night, we are fact-checking some of the most popular but completely untrue claims of the past several days. But first, 2 additional COVID-19 related deaths reported here in Bexar County. This brings the death toll to 24.
Both were residents of Southeast Nursing and Rehabilitation Center, the nursing home with the coronavirus outbreak. The patients, a man in his 80s and a woman in her 80s, both with underlying medical conditions. As of today, there have been 12 deaths at the facility. 74 residents and 27 staff members have tested positive. Meanwhile, the number of COVID-19 cases in Bexar County is now up to 665 cases, 50 more than yesterday. 243 were contracted through close contact with someone already infected. 210 were infected through community transmission. 151 cases are travel related. Tonight, 89 people remain hospitalized. 56 are in the intensive care unit. 44 are on ventilators.
It has been almost a month since the first COVID-19 case was confirmed here in Bexar County. That was on March 13th. About 2 weeks later, there were 113 cases, and only 4 days later, Bexar County crossed the 200 mark. From there, it took only 2 days to 313 cases, then 410 reported on April 5th. 2 days ago, we were at 503. Again today, we are at 665 cases. We have talked about the dire financial situation so many of our neighbors are in, and we've reported numbers giving dollar amounts to monetary losses in our community. But perhaps this video is the starkest reminder so far of the economic impact of this crisis here at home. This video shows thousands of families in their cars lining up to receive food at a mega distribution event yesterday. More than 1 million pounds of food was given away to 6,000 families. Earlier today, we caught up with San Antonio Food Bank's president and CEO and asked him about the situation.
San Antonio is a struggling community. We have a high rate of poverty and a lot of blue-collar, hardworking people, many in the hospitality, hotel, lodging, tourism, and restaurant industries, all of which those industries have been decimated. That's what we saw yesterday was so many families who they have no more money and they were scrambling to put gas in their cars to show up at a distribution where they hope to get groceries. We get food from so many sectors of the food industry. We work with food manufacturers, grocery retailers, restaurants, hotels, and caterers. Now, the restaurant, hotel, and catering food is gone. We're not getting that. The food from retailers, they're selling out. If we don't get some type of intervention from FEMA or the state of Texas, I know we're going to run out of food. Oh, truly unprecedented. I mean, I've never seen a line like that.
The food bank has another mega food distribution planned for April 17th, next Friday at the Alamo Dome. Pre-registration is required, and if you can, the food bank is taking donations. You can also volunteer. To learn more about registration and how to donate, go to safoodbank.org. Let's take a look at our surrounding counties now. Comal County is now reporting 37 positive cases of COVID-19. Hayes is at 79. Guadalupe County has 47. Wilson hit 10 today, along with Medina County. Kendall also at 10 cases. Bandera and Gillespie counties remain at 1 case each. Statewide, Texas is now reporting more than 11,600 cases and 226 deaths. Numbers across the state are still going up, but giving an update on the Texas COVID-19 response today, Governor Greg Abbott signaled that he is already thinking of strategically reopening the state of Texas.
Next week, I will be providing an executive order talking about what will be done in Texas about reopening Texas businesses also in a way that will be safe for that economic revitalization. We will focus on protecting lives while restoring livelihoods. We can and we must do this. We can do both.
The governor said he would provide specifics of the plan next week. He didn't give many details today, but he did say his plan includes testing and getting people back to work. A KSAT News at 9 update tonight. The San Antonio couple that was stranded in Peru when the country closed its borders because of the coronavirus is back at home, but they are now under mandatory self-quarantine. This is because of Governor Abbott's executive order mandating a 2-week quarantine for travelers entering Texas from locations with the biggest COVID-19 outbreaks. Our Tiffany Huertas tells us what their experience has been like and how the state is still keeping track of them.
I have my mom and my sister. They go to HEB, they buy groceries, and they just live at the garage door. And
these days, Jose Hinojosa and Ciul Cortez are not leaving their house because they are in mandatory self-quarantine. Last month, the couple got engaged in Peru. We spoke to them then as they were looking for ways to leave the country. Due to the coronavirus, the country closed its borders.
When we couldn't leave Peru, I contacted the embassy, so they just took our information, email, phone number, passport numbers.
After being stranded for 2 weeks in the South American country, the couple received a call from the U.S. Embassy in Peru on March 30th with good news.
We got a call from the embassy saying that we had a airplane confirmation. Before we got into the airport, they had a doctor checking our temperature.
The couple left the next day, had a connecting flight from Miami to Austin, and arrived in Texas on April 1st.
When we got to Austin, Texas, they made us sign a form where it's saying that you had to be on quarantine at your house for 14 days.
Jose says a special agent with the Criminal Investigations Division at the Texas Department of Public Safety even came to check on them.
You want to make sure that we are here, that we're following the quarantine.
DPS says those who are under mandatory self-quarantine must go directly from the airport to their quarantine location, remain in quarantine for a period of 14 days. Only leave the quarantine location if they need to seek medical care or to leave Texas. Those under self-quarantine are not allowed to have visitors, and DPS can conduct unannounced visits. For now, the couple continues planning their wedding, but believes things will never be the same.
I just think that life is not going back to normal after all this.
For the 9, Tiffany Huertas.
Let's take a look now at COVID-19 cases across the country. There are now nearly 500,000 cases being reported in the U.S., more than 18,000 deaths. Today, the global death toll surpassed 100,000. There are nearly 1.7 million cases around the world. Let's turn to tonight's 9 at 9. A woman charged after allegedly filling Easter eggs with pornographic images and delivering them directly to strangers' mailboxes. New clothing created to help wearers avoid surveillance cameras. Plus a look at how COVID-19 is impacting communities across the world.
Here's tonight's 9 at 9. A new Ebola death has been confirmed in the Democratic Republic of Congo. This comes a few days before the country was set to declare an end to its second deadliest outbreak. The World Health Organization estimates 2,274 people have died of Ebola in the current outbreak. The FDA reminding the public there is no cure or vaccine for the coronavirus, and until there is, stay away from so-called miracle cures that really are just toxic chemicals. The agency says a church in Angleton, Texas has been promoting one of these fake cures. It's actually chlorine dioxide. Chlorine dioxide is used as an industrial cleaner for swimming pools, and it can be deadly. The FDA warns they've got 48 hours to stop promoting it on the church's site. A racist rant against a Houston restaurant owner caught on camera.
Get out of our country! Get out! You! Get out!
The owner of Vitopia Vietnamese Cuisine says the verbal attack caught her off guard. Her business has been suffering due to the pandemic, but she says her family is trying to push through despite some tough days and negativity.
But we've got to keep going. That's the thing. We just got to keep going.
In Florida,
pretty bizarre, pretty deranged zealousness.
a woman is accused of filling plastic Easter eggs with pornographic images and then putting them in strangers' mailboxes. Detectives say she admitted to the crime, saying she was trying to educate people. She's facing several charges, including distributing obscene material and driving with a suspended license. Nearly a third of Americans didn't pay their rent this month. That's according to data from the National Multifamily Housing Council. The association says 69% of renters paid their rent between April 1st and 5th. That percentage 82% during the same time period last year. There's some new clothing that aims to help you evade smart cameras. It's not so much about going unseen as it is about distracting and tricking the system. For example, clothing from the product line Adversarial Fashion uses patterns designed to trigger automated license plate readers. According to the company's website, they inject, quote, junk data into the systems, overloading the surveillance software. TikTok donating $10 million to the World Health Organization's Solidarity Response Fund. The fund assists the WHO in various aspects, including sending supplies to healthcare workers and accelerating efforts to find vaccines. A World War II veteran in Oklahoma celebrated his 100th birthday with a parade.
I can imagine who did all this. I've got a lot of friends.
His friends couldn't get too close due to the pandemic, but his parade doesn't mean the actual party is canceled. It just means an even bigger celebration when this is all over.
Sometime in 2 or 3 months, I'm going to have them all out to my house.
Take a look at this. Hospital staff members cheer as a couple leaves the hospital after beating COVID-19. Dariella and Carlos both tested positive and were admitted to the hospital on the same day. After a long stay, they were both formally discharged. To read more about these stories, head to KSAT.com.
Hi there, meteorologist Katie Blake here. Let's get you ready for the Easter holiday weekend with a look at your forecast. So we've got 2 more rounds of storms in the forecast, one late tonight, one late Saturday night. Then things clear out wonderfully by Easter Sunday, and next week looks great. More sun and a lot cooler, so we have that to look forward to. But as I mentioned, we do have 2 more rounds of storms, one tonight and one Saturday night. Now, it's the storms Saturday night that have the higher potential to become severe and bring some large hail and damaging winds to parts of South Texas. So hail and wind will be the 2 biggest threats as we get into Saturday night, the pre-dawn hours of Sunday morning, with that second round of storms. The tornado threat is present. It's not non-existent. It's present, but it is low. A small number of storms may be capable of producing a tornado, but by far the bigger concerns will be for some large hail and then some damaging non-tornadic winds. So Futurecast showing us the storms that have developed well to our west this evening, continuing to move east, and this particular model brings them to I-35 in San Antonio in the pre-dawn hours of Saturday morning. It's certainly not out of the question that these storms make it to San Antonio, but they're not expected to be severe by the time they get here. But you certainly could hear a few rumbles of thunder and see some lightning in the pre-dawn hours of Saturday morning. By mid-morning Saturday, those storms are gone, and most of our Saturday will just be mostly cloudy. I can't rule out an isolated shower here or there, but the higher chances of rain Saturday will be very, very early in the day, likely before sunrise. Then we get to Saturday night. Things are still very quiet out there, but some storms will be moving in from far west Texas and northern Mexico overnight Saturday into early Sunday morning. So this is another kind of round of storms where they'll be moving through overnight while most of us are sleeping. So it'll be very important that you have your way to receive severe weather alerts on your cell phone or via weather radio, so you can be alerted to any severe weather while you're sleeping for the next couple of nights. These storms, round 2 of storms, are expected to move into San Antonio between about 2 and 5 a.m. on Sunday morning, again with the potential for some large hail and for some damaging winds. But look what happens by 7 a.m. The big severe weather threat is gone, maybe a few lingering showers, but we get to mid-morning on Sunday and we are in good shape. Skies will be starting to clear out, and it's really just overall going to be a really nice day. 84 your high temperature on Easter Sunday, so warm and also windy. We'll have a strong west wind in place at 15 to 25 miles per hour. So just know tonight, tomorrow night, as these storms move through, we're going to be here to keep you updated on our newscasts online and via the KSAT weather app, so that's a good thing to have on your phone. Next week looks wonderful. A front comes through early on Monday that drops our afternoon highs into the 60s. It'll be breezy for a couple of days, but overall pretty nice. We'll be back in the 70s with higher humidity by the end of next week.
Our coronavirus Q&A after the break. Welcome back. There is so much information out there about coronavirus and COVID-19, and not all of it is necessarily true or factual. So we're going to try to separate the facts from the fear. It's something we call coronavirus Q&A, and I'm very pleased to be joined by Dr. Lisa Ochoa. She's a vascular surgeon in our community, and she deals with vulnerable communities, I guess you would say, and vulnerable populations. And you have been a big voice for medical inequities that you see in our community. Does that carry over to what you're seeing with coronavirus and COVID-19?
The populations that have health inequities, which is our south side, our west side, and east side, already have multiple barriers that lead them to worsen healthcare outcomes. So those are lack of transportation, lack of access to healthcare, health literacy, infrastructure in their neighborhoods. And so, yes, these populations who also suffer more comorbidities or medical issues such as diabetes, heart disease, kidney disease, all the risk factors that we know that put a COVID patient at higher risk for complications and maybe death. And so already with the barriers they have and with the risk factors they have, it makes me concerned to make sure that we protect this vulnerable community.
These are not just statistics for you. I mean, these are your patients. I mean, you work in these communities, correct?
Correct. I have 5 clinics in San Antonio, focused in the zip codes in San Antonio, and so the healthcare outcome I follow are diabetic amputations. And so I have clinics in those zip codes with the highest diabetic amputation rates.
Yeah, which feeds into you being a vascular surgeon. That's what you obviously keep track of. What are you doing to try to help some of your vulnerable patients through this COVID-19 and coronavirus concern?
I think the first thing I'm trying to do is making sure that I reach out to all my patients and let them know that we are still here and we are open to take care of their serious needs. We assure them that we are taking all the sanitary protocols, that when they come in, if they're worried about a wound that's not healing or an infection that may be spreading or more pain that has been sudden onset, that they can come to the clinic and be seen in person and needed in a very safe manner. I also have noticed patients who just are fearful because they don't want to leave their protected home because of the fear and the anxiety of the COVID crisis. And so we reach out to those and offer them telemedicine visits, which was a quick transition for my clinic. We offer them just telephone calls because sometimes they just want to ask them questions. We actually offer them also to send in pictures of any of wounds or swelling, whatever they have, so that we use any avenue that they are willing to communicate with us, and I want to communicate with them and be able to make sure they get taken care of.
Is that one of your biggest concerns in this whole thing, that the fear of getting COVID-19 or the coronavirus is keeping people who should see a doctor away? Because I talked to an emergency room doctor who works at Methodist Hospital, and he says they're not seeing the volume they should see. He said they went 2 days without seeing anybody that suffered from cardiac arrest, and that's very unusual for them. Is that your greatest concern as well?
You are correct. I can tell you a lot of the patients I've spoken to are fearful to even come into my kind of controlled environment of my clinic. The other thing is a lot of primary care doctors and other specialists have closed their clinics and doing only telemedicine or limited hours. And so these populations, communities that already had so many barriers are now even more burdened and have to overcome more hurdles to get the access to care. And so I think making sure that we let our patients know if they need help, we are still here. There are doctors that are still here to see them, and will do so in the safest way possible.
Because for some of these vulnerable communities, telemedicine isn't necessarily an option, correct?
You're correct. I've run into some hurdles with patients when we try to do telemedicine. For example, some of my patients have flip phones, and so they can't get on video with their flip phones, or they have prepaid phones that don't have enough minutes to be able to video chat. And some of them just don't have the social media skills to be able to do that. And so what we've tried to make sure is that we vary what we offer them to what their needs are. If it's a telephone call, if it is at a nursing home, we have the nurses use their phones to help us video chat with our nursing home patients so they don't have to come to us. If it is they want to send me a picture of what their wound looks like on a weekly basis so I'm monitoring them, then we offer them whatever meets their needs.
Are you concerned that we're not seeing a complete picture from Metro Health when we see who's contracted and what zip codes and what demographics in San Antonio? Because a lot of the people that you're describing in these vulnerable communities might not necessarily get tested or have medical access to get a test.
You're correct. I mean, even now in the city, I know early we had limited testing, and even though that's expanded, we still have limited testings even in the hospitals. So I think once we're able to expand that testing, we're going to get a better idea. But like you mentioned, our already vulnerable population, I've actually had some patients call and they say, well, I have a fever and a cough, and they don't know that they have the option to call the hotline to get tested, possibly at the Freeman Coliseum. They're just not, they don't have the health literacy. They don't know that what their options are if they are suffering some of the concerning symptoms for a COVID infection.
What can the average San Antonian do to help these communities, help these people that need access to some of these services?
Well, there are several nonprofits and even for-profits in town that have really pivoted to focus on these vulnerable populations. And I know you've interviewed people with a food bank, and they're doing a fantastic job, and I think donating to them is great. There's also some smaller businesses. For example, Folklore's Coffee Shop on the south side. They have pivoted their business to take in donations and are delivering dry goods, fresh fruit, and we've donated some toiletries to those communities who cannot leave their home or maybe quarantined or don't have transportation and don't have access to basic needs like food and toiletries. And so look for those people who are helping, and if it's a financial donation, I know these delivery places need drivers. If you're available to help deliver to these communities, I think that'd be very, very helpful.
I want to give you the final word tonight in this interview. What is the one message that you would like to get across to our viewers?
My message would be to make sure that everybody knows that if they still need health care, if they still have acute medical issues, whether it's acute asthma or foot wounds like I take care of, that there are doctors out there that can still see you and see you in a safe way. And please reach out to us or out to anyone who you think needs help. Encourage them to seek medical help. The last thing we would want is to delay care for these acute medical issues and they end up in the hospital anyway.
Dr. Lisa Ochoa, thank you very much for your time. I appreciate it.
Thank you.
We'll be right back. We got some late breaking news. 11 more Bexar County deputies from a recently graduated cadet class have now tested positive for COVID-19. This comes after the entire class placed on leave Sunday after one deputy tested positive. This now makes 13 deputies that have tested positive from that same graduating cadet class. And today, local leaders announced 2 facilities will be used to house COVID-19 patients, specifically from nursing homes. During today's daily briefing, both Mayor Ron Nirenberg and Bexar County Judge Nelson Wolf announced Westover Hills Nursing Rehabilitation and Health Care and River City Care were chosen as those locations. The mayor added that managers of nursing homes in the region helped to select those facilities, which are currently empty. This news comes after we learned of 2 more deaths at Southeast Nursing and Rehabilitation, the local nursing home with the COVID-19 outbreak. Those residents will stay where they are.
The only COVID nursing home patients now, I believe, are over at the Southeast, and they will remain there. They're not going anywhere. We haven't had any in any of the nursing homes.
The mayor and judge say more than 100 rooms are available at Westover Hills. They prefer that site be used first, given that it's relatively new. The judge also added he did not want any patients outside of Bexar County staying at either of those facilities. Turning to tonight's top stories, the first Bexar County jail inmate is tested positive for COVID-19. According to the sheriff's office, the man incarcerated on a family violence charge. None of the other inmates housed with the patient have shown symptoms, but the sheriff's office has requested to test all inmates housed in affected units. Meanwhile, all roughly 3,000 inmates will be wearing surgical masks at all times to prevent the possible spread. University Hospital implementing a sterilization process which will allow N95 masks to be used 4 times instead of just once. The masks will be collected at the end of each shift. Any with damages or stains will be thrown out. The sterilization takes up to an hour and each mask is checked for any lingering germs. This does not replace the need for new N95 masks, but instead helps expand the hospital's supply. And just a reminder, we know Easter camping There's been a lot of misinformation when it comes to the coronavirus, and you can't trust everything you see online. That's why the Associated Press has been fact-checking some of the most popular but completely untrue claims surrounding the pandemic for the past several weeks. Let's take a look at this week's fact check. Here's our first claim of the night. Maps show a correlation between confirmed COVID-19 cases and locations where 5G wireless service has been installed. Here are the facts here. There is no evidence to suggest that 5G or 5th generation wireless is related to or causes the novel coronavirus. In fact, there's plenty of evidence to refute the link. For example, South Korea, the first to launch 5G wireless in April of 2019. It would be another 8 months before COVID-19 cases were announced in Wuhan, China. And Japan didn't launch 5G until last month, but the country reported its first coronavirus infection in January. All right, here's another one. Due to the pandemic, effective immediately, Walmart adopting a staggered shopping schedule based on age. Also not true. We actually heard the same thing about H-E-B. Walmart is offering special hours for seniors, but it has not designated times for people to shop by age group. The chain has also revised shopping hours to allow workers to restock shelves for customers and clean and sanitize their stores. And the last claim we're fact-checking tonight, tonic water or quinine supplements can be used to prevent or treat coronavirus symptoms. Medical experts say as of now, there is no proven medication or home remedy that can actually cure the virus. People across the city have stepped up to help those in need and others that have been affected by the COVID-19 pandemic. RJ Marquez tells us about the good things being done in our community in the Week in 210.
The South Texas Blood and Tissue Center announces it's participating in a federal program to begin collecting plasma from people who have recovered from COVID-19. Researchers believe the antibodies found in that plasma could help those still suffering.
If it's such a simple thing as giving plasma so that someone else cannot go through it, or they can lessen or take them off a ventilator or something, we should all be doing that.
You must be symptom-free for at least a couple of weeks to donate plasma. Email covid19@southtexasblood.org for more information. H-E-B is delivering more than 75,000 meals to healthcare workers across Texas over the next 5 weeks. 600 H-E-B Simple microwavable meals were dropped off today at Christus Santa Rosa Hospital Medical Center.
Every bit of help to them not only helps them, but shows that the community appreciates what they're doing. And, you know, sometimes just that thank you, in addition to this, is really helping people get through this.
This is a part of H-E-B's charitable investment where they have donated more than $1 million in truckloads of meals. Rebecca Creek is known for its vodka and whiskey. Now the distillery is getting into a new charitable business. Rebecca Creek started creating sanitizer that's being donated to first responders.
The responders are out there calling on everybody. They need to be protected. So this is, you know, they're a great community for us. So this is what we can do to help out.
Shifting production also gives employees the opportunity to continue working through the pandemic. USAA is helping members during the pandemic. The San Antonio-based company will return money to members who have an auto insurance policy. People who have an auto insurance policy will receive 20% credit on 2 months of premiums in the coming weeks. A San Antonio family is not allowing the pandemic to break their bond and tradition. Abel Valdez posted a tweet of his family surprising his 83-year-old mother Herminia at her home on the west side. Valdez said his mother has not left the house or had any visitors. Her children, grandkids, and great-grandchildren decided to surprise her with a parade so she could see everyone.
What's up, guys? Hope you guys are doing well. It's time to check out some stories that are trending today on KSAT.com. And we start with a very interesting interview with Chris Perez. That, of course, is the husband of the late Selena Quintanilla. Chris Perez gave us an exclusive interview where he kind of talked about Selena's legacy and his career after she tragically passed away. It's very interesting to kind of look at it from his perspective and kind of what he has gone through after her passing. We also talked to Chris about his new band and a new line of hot sauce that he also has. So he has definitely been busy. But if you want to check out this interview, you can go to KSAT.com. And also don't forget, we are going to have an hour-long Selena special called Siempre Selena. That is going to air Sunday on KSAT 12, and it really kind of looks at her life and legacy and why she is such a cultural icon in San Antonio and South Texas. So make sure you check that out as well Sunday night at 9 p.m. on KSAT 12. All right, moving on to our next story. We're all kind of bummed out, of course, that Fiesta is not taking place when it usually does, always kind of in mid to late April. But KSAT is doing something kind of cool. We're going to be kind of bringing you the parades from last year on their original days that the parades this year were supposed to take place. So we're going to be re-airing those. And we're also going to be kind of promoting a bunch of charities that are also associated with the Fiesta Commission as we all try and support one another during the coronavirus pandemic. So again, it's unfortunate we're not going to have Fiesta as previously scheduled, but we are going to have it in November, so that's going to be kind of a different sort of feel. But if you still want to get, you know, the cascarones ready and all that stuff, you can check out these parades. They will air on the dates that they were scheduled to air this year. So all you got to do is check out the schedule on our website, ksat.com. All right, last story of our trending segment. Okay, so chances are you're probably going to be at home this weekend. So we have an article that has 7 new ways or 7 new things to watch on Netflix with the kids. So we're talking Ozark, Tiger King, not really, just playing, not those. Okay, actually these are some definitely kid-friendly stuff. One is called Beat Bugs. It's like a cartoon about bugs that sing classic songs. So in this one cartoon, Beat Bugs, they do a bunch of Beatles tunes. That's kind of interesting. Another one that is called Leap, which has to do with a dancer kind of getting into her prime, just kind of like a adolescent dancer. And the one that definitely kind of caught my attention, Shrek the Musical. All right, what is going on with Shrek the Musical? I've not heard of Shrek in the past decade or so. What I thought was funny about this article was it says, the donkey is as funny as Eddie Murphy. I find that very hard to believe, but you'll have to check that out for yourself. We have a lot more options here to watch with your kids this weekend on Netflix. All you gotta do is go to our website, ksat.com, and check that out. And that's it for our trending segment. You guys be safe, be healthy this weekend, and I will check in with you guys later. Bye.